money for the entire year, and you can do nothing about it now.
Problem.
The cow, you know, all the time, almost time we didn't have the sonography to check what's
Yeah.
the time of burial. Some cow have silent stress.
Yeah.
So how we can know if we didn't have this system?
Well, are you all running a bull or is it just AI?
AI or just bulls? We need
Because
to.
bull knows.
Ah,
it's
yes.
Not, it's not silent to the
yeah,
bull.
it smells the stress.
It's silent to you.
Yeah.
You know? So it depends if you have a clean-up bull. So if you have a clean-up bull, then he'll still do fetus on the same screen. Otherwise, you kind of go like this, and you see one, and you see another one. Is it the same one that I'm just cutting twice? Right? So it's quite. I find it quite difficult. And then the other thing we can do is we can sex the fetus. At about day 56, we can see the genital tubercle, and if you see any here, I'll point it out to you, and you can identify whether it's a bull or a heifer. Okay. Again, I'm not great at it, but when I do see it, I do know. When I don't see it, kind of thing, right? And then pregnancy. We used to do 60-day rechecks just to make sure that it hadn't been lost. But now I don't see the value in it, because very rarely do you get a pregnancy and then lose a pregnancy. I'm not saying it doesn't happen, but very rare. Okay. And then the other things that we want to pick up with on ultrasound is we want to be able to identify if we have cystic situations, what type of cyst there are. If we have a follicle, if we have an ovary, if we're doing, so if I'm doing artificial insemination, if we have an artificial insemination service, and these are professional AI inseminators, they're not vets, right? So vets in Trinidad don't inseminate cows. I know in India the vets did that, right? Both vets and right? But if I happen to be on the farm when he's there, he'll be like, "Doc, which side?" Right? Because I could tell him where the big follicle is. So he'll go more to the left and increase your chances of getting a conception. Okay? You can also pick up fluid in the uterus. Okay, so whether we have a pyometra or endometritis. So the definitions are: metritis is in the first 21 days after calving. Endometritis is after 21 days. Okay? So endometritis, the typical, I don't know what word you all use, we call it whites. So you see a white discharge from the vulva. Okay? It doesn't cause the animal to become clinically ill, like she's happy eating and drinking, but it does reduce her chances of conceiving. Okay? So we do need to treat it. Okay? What do you all treat endometritis with? Do you put antibiotics in?
Yeah, for milking cow we use Ceftiofon.
Ceftiofon. Okay.
So the milk can.
But you all have I don't remember the name of the drug. No, it's cephalexin, but it's called no, it's not Ceftiofon, it's cephalexin. Oh gosh, I'll remember it after and I'll tell you. But it comes as a preparation. It's the only preparation license in Europe and UK. It comes in a white tube with a green.
Intramammary?
Yeah, it's not an intramammary, it's an intrauterine.
No.
For nectarine.
I try.
Now, how much is this?
I can't believe what kind of number it's called.
Sometimes we do the antibiotic points and so.
The bone is
We take
Yeah, come to me now.
last time it comes in a tablet.
No, it's not a tablet. It's not a pessary. The pessaries, I don't like the pessaries. For me, the pessaries is treating the farmer. It's just making the farmer happy that you did something. You don't really do a hell of a lot, right? Because pessaries, you want them to work in a little tablet to work in a whole pool of pus. That's gonna do nothing. Yeah?
Flushing will work.
Yeah, again, they don't know. They say not to do it in horses. I had a metritis once, a toxic metritis in Bristol, and we thought this animal was not going to make it. So we put a hose in and we built a siphon and we flushed it in. And when I flushed out all the water, I noticed there's a bar of soap in the water. So I ended up washing this out with soap. So I was kind of That's not good. And the cow made a wonderful recovery. So apparently it's supposed to put soap into the cow. Yeah. So yeah. If I what? Lugol's iodine is a bit harsh, and you could burn the mucosa. So if you're going to use it, you're going to use very dilute solution. So we don't typically do that. I typically just treat with Jogex, which I cannot remember. So you pass the pipette through the cervix and you give that, and tend to give prostaglandin, right? So that you basically bring the animal back in heat. Okay. A lot of these animals that have endometritis will clear it out on their own. 90% of them, they have a lot of gunk in there, and it's just going to take time, and they'll clear it out on their own. And it's just, if I check and I get whites, or especially on the postpartum check, right? A lot of times I'll be like, it's not too bad. Let her cycle once, so where she push it out on her own, and then if she's still not clear the second round, then I'll come and treat. Okay? But I don't rush to go and treat. I'm a very hands-off vet. I tend to go, right, if I can. I don't rush to go to a calving if the cow is going to push it out on her own. Right? I prefer to stay in my bed and go to sleep. Yeah? But you have to know, if you're going to do that, you have to be very good on monitoring. So that if the situation changes, right, I'm off. Yeah?
So, what's your opinion on excessive retained placenta? Is it best to cull or to push it back or put it back?
No, I don't think we have a big problem. Retained placenta usually is, this thing is related to zinc and vitamin E, selenium and vitamin E deficiencies. I remember one farm where I went and I ended up taking out about 4, and I'd been at a party the night before and I was hungover, and taking out 4 retained placentas is not a good thing when you've had a few. And but she was the only farm I ever had where you had a lot of cases of retained placentas. So it more like not has a nutritional basis, you know. But in terms of retained placentas, what we say is so you don't pull aggressively. You pull to this sort of strength, to the strength of your hand, just that, right? And if it doesn't come, leave it. If it don't come, leave it. Because what is going to happen if you pull, you're going to rip inside, right? If you rip inside, if you rip the placenta inside, and this bit comes off, right? Then there's no weight to pull the bit that's inside, right? So how I tend to do placenta, if I'm trying to pull off a retained placenta, and this is, right? If this is the cervix, so this bit is inside, and I'm here, I tend to go up to as far as I can up to the cervix, and pull my finger around, right? And pull down. Just slow kind of thing. And then as it comes back a little bit, then I go further and I pull. So I don't end up pulling from here. Because when I pull from here, I'm going to rip here. So I always try to pull from as far forward as I possibly can. And if I don't feel it coming, and you tend to get it, nothing, bloop. Because what happens here is behind the cervix, it's got a big lump of it. And once you pull that out, it just comes out. And you want to have a look at it. You want to spread it out and look and make sure the whole thing is out. Okay? So as I say, again, we have a lot of problems with government vets who want to go and pull it out. Right? You have to go and pull it out. Yeah? And they teach the students, you have to pull it out. No. You go, I don't even go before 72 hours. 72 hours is not an issue for me. Right? I'll come and check it out. Why it might be a problem for the farmer is the smell. And he's trying to milk a cow and this thing is, right? So what you can do is maybe just tie it up. Tie a knot to itself, right? Because you want the weight of what is outside to pull the weight of what is inside. I see some books say tie a rock to it and that's
Not recommended.
not recommended. Yeah, and then you have a cow walking around. Right? They're trying to hit you and whatnot, right? So just knot it on itself. Right? So I will try to pull, and if it's not coming, I leave it. And I've left retained placentas in for 10 days. Not a big issue.
10 days is too much.
Yeah.
10 days it will be to 75.
7 days, fine. Now, what I will do, same thing we just spoke about, I will monitor it. Remember, retained placenta doesn't mean metritis.
But they will cause.
It can lead to a metritis.
Ah,
It can lead to a metritis.
yes,
That's the difference,
correct.
right? So if I see that I have retained placenta, but the cow is eating and drinking fine, it's a bit smelly, all right, well, I'll leave it a few days and I'm back down on this side on Tuesday, or I'll come and take it out then. Yeah?
But
It's-
if we leave it, we find the animals will stop eating, then temperatures become high.
If that happens, then you're treating for the metritis.
Ah, so we should be
Yeah.
start to take
Yeah.
fast.
So that's what I'm saying. I don't rush to take out the thing unless animal becomes sick. Most animals that have a retained placenta will not become ill. Yeah? Metritis doesn't. There will be inflammation. There is, by definition, there is a metritis. But I'm not talking a clinical puerperal metritis, which causes the animal to stop eating and get temperature. Most animals won't do that. Yeah, but you're rightly started with anyway, so you're not putting the milk into the tank until 5 days anyway.
Can we
So-
go for antibiotic for secondary just in case?
If you want to, if you're ready, think. But then again, the whole point was, remember that the bacteria are helping the breakdown between the placenta in the cotyledons and in the placenta, right? So if you now get rid of that bacteria, then you actually keeping it more firmly attached. That's the idea. I don't know how true that is, you know. But I don't tend to rush to give drugs unnecessarily. That's what I'm saying. You know, different people have different schools of thought. I have no issues with that.
Doctor,
But I
can
do
you use
assume-
prostaglandin day form?
Yeah, you could give prostaglandin if you want. Remember, you can't give oxytocin after 24 hours because oxytocin receptors disappear, right? So if you're coming after 24 hours and you want to give, you can give some 2-3 days. You can give prostaglandin. If you have a retained placenta in a sheep or a goat, that's a little bit different. Then I'm much more aggressive, and then I will give prostaglandin, right? Because those animals will get metritis and get sick. But with cattle, it doesn't tend to be a big issue. No, you might be seeing something different to what I see. So if you think that all of them that have retained placentas get sick, well then take them out.
Ah,
You know,
Because our
yeah.
local weather here more hot and humid.
Yeah, it's a
More
humid, more
bacteria.
humid, it's a much more
Compared
humid
with the
situation in
Western world.
Trinidad. Yeah, but as I say, we 10%. We send the students out to go and take it out. Yeah. I don't put my hand in.
herbal medicine.
Herbal product.
We have a set of
Okay.
which we give
Dato ada boleh beli untuk 1,000.
despite of whether it's already out or not, we give to the person and the result is good.
Okay. Anything else you want to discuss?
No, okay, that is
Well, if you have a cow that typically doesn't demonstrate a very obvious heat, right? The offset protocol is kind of really works well for timed AI. Okay? So as instead of AI to observed heat, I can do the offset protocol and 16 hours later I come and inseminate, regardless of whether she's showing heat or not.
Oh,
Okay, so that eliminates the need to see a heat, so whether she has a silent heat or not. And typically, the herdsman who's dealing with the animals knows, right? So some animals will come in heat and go jumping and whatever,
yes, yes.
and some animals will come, how you doing? Right? And that's it. And that's all she does. But a herdsman who's a good herdsman who can see things, he knows his cow. He knows that's what that cow does. There's a big difference between her and her.
it's not so
Yeah?
bad, so kind.
Yeah? So that, yeah?
Experience.
Yeah. So he knows. From the time he sees this cow comes into milk. So you have 100 cows coming into milk. If that the milking order is very hierarchical. Right? Cows have a hierarchy. So the big strong cow, she comes in first because I'm queen, right? And then everybody else comes in according to their station in life. Right? And then you have now cow who typically comes in last year. I'll come in top 30 this time. And just that alone, just that change in the milking order could be significant. Yeah? That it's that she's something is happening. It may not be heat, it may be something else, she might be ill, she might be whatever. Right? But those little things, right, a good herdsman picks up on. Yeah? That you wouldn't pick up on. You might be the greatest vet in the world for 40 years and you don't know it because he's the one who sees the correctly. Yeah? Yeah?
Doc,
Yeah.
on the off scene, you said day 0, day 7, day 9. After that, maybe 3 days, the animal will come and eat.
Yeah, about 2 days. It's usually faster because you're giving that generation. Remember what I said with the off sync. The animal, you can stop off sync here on just these 2 injections. It will come into heat. The problem is, well, not the problem is, the thing is that there's going to be variability in the time it takes. So they may come in 2 days, 3 days, 4 days, some 5 days, right? So this second generation closes that window even further. But if I didn't give it, they would still come in.
So meaning, based on this calculation, they will come on heat at day 11 or day 12.
Usually about day 11, it's usually faster.
This time you were telling me, you use off scene,
Yeah.
you can go for AI on day 16
No, on 16 hours.
or 16 hours.
16 hours after the injection in January. 16
Oh, right.
hours.